Hi everyone, I am Dr. Anisha and today I will be discussing about a very high yield topic for your exams point of view, that is hydatid disease. Now under hydatid disease, I will be taking up the most important causative agents, then what causes the formation of this cystic disease, then what is the structure of a hydatid cyst and the complications related to it, and finally the images which are very frequently asked in your exams from this particular topic. Now when we talk about hydatid disease, what do we understand by this term hydatid? Now hydatid, it stands for any fluid filled cavity, any fluid filled cavity or bag. Fluid, as you can appreciate in this particular image, can you see these small multiple round balloon like structures, globular structures which are filled with some clear fluid? So these are nothing but these are hydatid cysts, right? And on the right side, can you also appreciate this picture showing you water balloons? So does it give a very similar picture of what we saw for this cyst, that is hydatid cyst? The water balloons, right? They are somewhat consistent with fluid, and the fluid is clear, and this is how we can correlate with the water balloons with which we played very recently on Holi, right? So now of course this is a parasitic infection or parasitic disease. So what causes hydatid cyst? So it is the tissue cystodes which are responsible for this particular disease. So in order to help you out to remember what cystodes are, so I have a mnemonic, that is taped tote bag. Taped tote bag. So I have replaced tod with tote. So what kind of organisms are these? These are flat, segmented, and dorsoventrally flattened. So whenever we would be talking about cystodes, we will be talking about certain worms which are flat. They have multiple segments and they are flat, just like a tape. Very thin, very flat, and this is how we would describe cystodes. So now what are the important causative agents which are responsible for cystic hydatid disease? So firstly, we have Echinococcus granulosus. Another species, Echinococcus multilocularis. Then we have Echinococcus vagellii, as well as another species, that is Echinococcus oligarthrus. Now these two species are rarely associated with human infections, so we will not go much into details of these two, but these are responsible for polycystic hydatid disease, and this is found in some certain lower animals but rarely found in humans. Now Echinococcus multilocularis, can you make out from the word multilocularis multiple locules or multiple cavities, just like it is found in the alveoli of the lungs, right? So it has derived its name from multilocularis or alveoli, but the disease which it is responsible for is alveolar echinococcosis. right? Moving further to most important species which is responsible for cystic hydatid disease, it is Echinococcus granulosus, and it is causing cystic hydatid disease. Cystic hydatid disease, right? So whenever you are asked about the causative agent, if one, then it is always going to be Echinococcus granulosus, right? So now moving further towards the first species, that is Echinococcus granulosus. Now it is also known as dog tapeworm. So all these cystodes are going to be tapeworms, but we specifically call Echinococcus granulosus as dog tapeworm. And why is that? Because dog is the definitive host in this particular disease. To know about the host, the definitive host, the intermediate host, or the accidental host, and certain buzzwords or certain one-liner questions, I have made a mnemonic for you to remember this particular parasite along with the important signs which are very frequently asked in your exams. So the mnemonic that I have used is, it says like district, hospital, ECGs. Now at our times, district hospital ECGs rarely worked. They were really bad. So you might just remember it with this mnemonic. So D stands for dog, which is the definitive host, right? Then we take H as humans, which are the accidental host. We humans are considered to be accidental hosts. And also H stands for another important sign which is ours, that is honeycomb sign, an important radiological sign. We will see that in later sections. Honeycomb sign, right? Then E of course stands for Echinococcus. C, the other letter, C stands for few things. Firstly, the cysts which are present in this disease, the cyst. So don't remember this mnemonic, pertaining to, we are talking about Echinococcus granulosus. So we have to remember it, it would be helpful only to understand the important signs or the definitive host. Whenever Echinococcus granulosus comes, you should remember district hospital ECGs, so that you know there is a presence of cysts. They are going to be caused by cystodes, and you'll see multiple radiological signs. So that will help you understand better. So cyst, then it stands for cystodes. And one very important, again a very important test, that is Kseni skin test, which is obsolete now, but in earlier days it used to be done. It was used for such patients who were hypersensitive to this particular antigen taken from this particular cyst structure. So what was done prior, that any whether it was accidental host, whether it was human or it was intermediate or sheep, so some amount of fluid, as in around 1.2 to 1.5 amount of fluid, was extracted from the cyst structure. Then it was sterilized by filtration, and that fluid was injected into the sensitized host or the the patients, and that fluid, around 0.2 ml of fluid, was injected onto the forearm, and it was kept for around 30 minutes to look for the presence or development of a wheal of around 5 centimeters. If a wheal was developed, then it was considered that the patient is hypersensitive to this particular antigen, and he might have had any sort of exposure, right? So this test is not done nowadays because of certain cross reactions. So, but it is very frequently asked in your exams. Questionnaire skin test is done. It has been asked multiple times for which parasite. So you must remember it from this mnemonic, right? Then we come to another letter, that is G. It stands for granulosus. And you also remember granules in this particular disease. You will understand it in later section. Then another letter, that is S. S stands for sheep. And another important radiological sign, that is snowflake sign, right? Sheep here is the intermediate host. So this was about the important host, the signs, presence of cysts, etc. So you also must know that this Echinococcus, this parasite, it is present whether it is in humans or it is in the intermediate host or the definitive host. So this Echinococcus, it exists in 3 different forms. So firstly, we see this is the adult worm. And where would it be present? Where would we find this? This would be found in the dog or the definitive host. And where? In dog's intestines. In dog's intestine, right? Then the second stage, which is the larval stage. So it goes the other way around. We first have the eggs, then the larval stage, and then the adults, right? So larval stage would be found in the intermediate host, or rather we can write the sheep as well as the humans. So you must remember that this cystic stage, it is the larval stage, or the cysts which are formed, these are nothing but the larval stage. And thirdly, the eggs. Now eggs would be released in dog feces, right? So these eggs are also somewhat similar to Taenia eggs. They have outer covering. So you must not get confused when given such picture, and if a clinical scenario is asked from you guys, then definitely along with the eggs, a proper history and some more cues will be provided. So do not get confused when we give similar eggs of a particular parasite, right? So to understand the structure of the egg, we have an enlarged picture. So can you appreciate this round structure? And it has 2 sections. See, if you look closely, I think all of you must be able to appreciate these striations, vertical striations. So this area having vertical striation, this is nothing but the embryophore. Embryophore, which is the outer covering which is used to protect the this oncosphere or the growing embryo. This internal structure, it is the oncosphere. This has the growing embryo, and you might not able to appreciate it here, but this also has 6 hooklets inside, 6 hooklets, which are also seen in Taenia eggs also as well, right? So this embryophore, it is hard outer covering, and what is it made of? This is made up of keratin-like protein. So whenever we talk about the pathogenesis, so it is the oncosphere that needs to come out of the egg and go further with the developmental stages ahead. So embryophore ruptures and the oncosphere comes out, right? You need to remember it from this diagram or this image. So now when we say we talk about consumption of contaminated food or consumption of a particular egg, it leads to a disease where multiple cysts are forming in your body, and not just one site, it can form at very different sites. But it also leads to hazardous conditions, right? So how are these cysts forming? Just mere consumption of egg might lead to formation of these cysts, which you need to get removed surgically, mostly surgically, and then you have conservative methods as well. So how are these cysts forming? Firstly, mode of transmission, definitely it is going to be ingestion of eggs. Now, since it is pathogenic to human beings, so firstly we will be talking about how are these cysts forming and how are these infecting us. So humans are going to consume, are ingesting contaminated food, and this food is probably contaminated with dog feces, and it is the dog feces which probably contains Echinococcus eggs, right? So these eggs, after consumption, now they need to be transformed into larva. They need to develop into the larval stage, right? So where is it occurring? So it is in the duodenum in human intestine. It is in the duodenum where the oncosphere is going to release, the embryo-4 ruptures. Embryo-4 is going to rupture. Embryo-4 ruptures and the oncosphere comes out. Now this oncosphere, it gets attaches to the intestinal structure, intestinal wall, and then via portal circulation it is carried to liver. Now a lot of thing is happening, you have a foreign body or a parasite inside, and our body or host body, it needs to get rid of it. So it has to get rid of the parasite, and in doing so, what is our body going to do about it? It is going to mount an immune response, and because of that immune response, what is going to happen? Inflammatory reaction is going to occur, right? So firstly, our body, host or human body, it mounts an immune response, right? And because of that immune response, inflammatory reaction occurs, reaction takes place, and once an inflammatory reaction occurs, most of the oncospheres, because of the immune response, they get destroyed, while some, they now develop into these fluid-filled cavities. Mostly the oncospheres get destroyed, right? Oncospheres are going to get destroyed, while some will develop into fluid-filled cavities. Now these fluid-filled cavities, they get encysted by fibrous tissue, and this fibrous tissue, where is it derived from? This is derived from fibroblasts. So this is how these fluid-filled cavities get developed, right, inside human body. Now we have spoken about human body, and same is the case happening in the intermediate host as well, that is the sheep. So we said humans are only the accidental host. Otherwise, these eggs would be eaten up by sheep, but humans get accidentally infected with such dog feces which have the Echinococcus egg, right? So what exactly is happening in the dogs, right? So dogs, or the definitive host, it feeds on the carcasses or contaminated viscera of sheep, right? And this contaminated viscera, these contain mature hydatid cysts. Mature hydatid cyst would be present in the viscera of sheep. Now these cysts, they need to be developed into the adults, right? So in dog intestine that is happening. So in intestine they develop into adults, right? And after development they are definitely going to get fertilized. They fertilize, and thereafter they are going to lay eggs. The Echinococcus eggs, which would be eaten up by the humans, and they are going to be pathogenic to humans, right? Humans as well as sheep. And this is how the cycle goes on, right? This is the whole pathogenesis that that occurs in humans and the sheep and the dogs. So how the eggs are consumed and how they are getting converted into the cystic forms, right? So we can now very easily understand it from the life cycle. So the adults are present in the small intestine of the dogs. They are going to lay eggs. These embryonated eggs would be present in the feces. Now these eggs would be taken up by the humans as well as the sheep. They will be eaten up by humans and the sheep. Same cycle continues. So the oncosphere is going to get released in the humans as well, and the oncosphere is going to be released into the in sheep intestines as well, which will later convert into hydatid cyst in various organs in humans, and also hydatid cyst. So all of this is occurring consecutively. Same cycle continues in the sheep and the humans. So hydatid cysts are also going to form in the sheep as well, and these cysts will ultimately lead to the formation of adult worms in occurring in the definitive host or dog. So dog is the definitive host, this is the sheep. So this makes us understand the whole cycle, what all takes place, right? So moving on to the next important point in this particular disease, it is the structure of the hydatid cyst, and it is very frequently asked, right? So see this picnomic of a hard-boiled egg. So we will be considering two layers of this, the outer shell and the egg albumin or albumin of a hard-boiled egg. So this shell, it is hard. This will be consecutive with the outermost covering of the cyst, whereas this albumin part, this will be considered as the next layer, and the third layer we'll be discussing about that later, right? So whenever we talk about any cyst or any particular whether it is a tumor developing in our body, whether it is a tumor, whether it is a cystic disease, or any structure that forms inside the body, it is very important for you all to know that the outermost covering, it is always going to be host derived or human derived. So the outermost covering will definitely take its blood supply from the host as well, right? Every tissue that will be derived is definitely going to be from the host. So remember that for all the tumors or all the fluid-filled structures or everything that develops in our body, right? So firstly, let us take into consideration this outermost layer. This outermost layer, this is known as the pericyst. Also keep in mind the outermost covering which is present in the egg, right? This is the pericyst. The layer underneath the pericyst, it is known as the ectocyst, right? The green colored layer here, it is known as the endocyst. Ecto means outside, endo means inside. So it is definitely going to be inside. Endocyst. Now can you appreciate this green, this structure, that is this round structure that is connected to this endocyst layer, right? So this area is definitely going to be called as stalk. And this internal globular structure, these multiple structures which are present, these are nothing but the brood capsules, right? And this whole yellowish area, this is the fluid, hydatid fluid. And these, head-like structures, multiple head-like structures, these are nothing but protoscoleces, which are the future head, right? And these, can you appreciate these, not unenclosed structures which are lying at the bottom of the cyst structures? These are going to be deposited as granules, and it is very easily seen on, ultrasonography. So this you need to consider and remember, right? So these are also protoscoleces. And these red lines, these are nothing but the blood vessels. And how are we getting these blood vessels? These are host derived. So these are blood vessels. So now let us see another image, another important image. So it is similar to the previous image, but can you see this enclosed structure, this encysted structure? It also has two layers in it. So these are nothing but daughter cysts. And what are these daughter cysts? These are nothing but these structures which develop when the brood capsule ruptures, and these cysts, they get enclosed by two layers. It is composed of ectocyst plus the endocyst, right? So these two layers develop, and these structures give, a view of a cyst within a cyst, right? And it is very well appreciated under the ultrasonography, and you'll see it with the help of an image, right? So now let us get into the details of these things, or the composition of these layers. So pericyst, we have already discussed, it is the outermost layer, right? And it derives its blood vessels from the host, or the human host, right? So this is the outermost layer. It derives its blood vessels or blood supply from the host. So now when we talk about the ectocyst, in order to remember what is it composed of, I have a mnemonic, HATE, right? So HATE firstly stands for hyaline. Remember an egg albumin. So if we see a raw egg, so the albumin looks hyaline, right? So we can remember it with the help of this mnemonic, hyaline. These are acellular. These are tough yet elastic. So when we touch the egg albumin of a hard-boiled egg, we know it is tough to touch, but it is also elastic, and these are also glycan rich. Now talking about the thickness of ectocyst, it is around 1 mm. You need to remember this, right? Now this endocyst, it is also known as the germinal layer. This is the germinal layer, and it has two functions. So since it is the innermost layer, so on the outside, on the outer surface, outer layer, it is going to give rise to the ectocyst. Endo, it is giving rise to the ectocyst on the outside, whereas on the inside, it is going to give rise to brood capsule. It is going to give rise to brood capsule, right? And the about the thickness of endocyst, it is around 25 to 27 micrometer, right? So this also you need to remember. Now what is this brood capsule doing? Brood capsule, it is going to give rise to, firstly, hydrated fluid. It is this brood capsule which is going to release or secrete hydrated fluid, and this is the first thing. And second thing, it is going to give rise to the protoscolysis or the future head. Protoscolysis, right? So it is the protoscolysis which are getting attached to the inner surface or inner portion of the brood capsule. Coming towards the composition of hydrated fluid. So this fluid, firstly, it is going to be pale yellow or it is going to be clear, mostly clear, right? And it has a special property. It is antigenic. Hydrated fluid is antigenic, and because of its antigenic nature, it is responsible for the complications associated with hydrated fluid or hydatid disease. And the complication, it is the anaphylaxis. Anaphylaxis, right? So the hydrated fluid is clear and it can be pale yellow as well, pale yellow, and its pH is somewhat similar to the neutral. It is towards the neutral pH. So you need to remember it is around 6.7. And chemically, what is hydrated fluid composed of? It is composed of sodium chloride, sodium sulfate, sodium phosphate, and it is also composed of succinate. If you remember, in the first mnemonic, we said with G, you must remember another term, that is granules. And also in the image, if you remember, we saw these, structures. See, if you consider this image, we saw these structures or protoscolysis which have settled down at the lower end of the cyst. So these will be seen as granules under the radiological images. So it is the protoscolysis which are getting deposited at the bottom as granules, right? It is the protoscolysis which are getting deposited as granules. Color, we have already discussed. It is going to be mostly clear, but it can be pale yellow as well, right? Now moving towards the size of the cyst. Now these cysts, these can be as small as few millimeters to as big as more than 30 centimeters. So the rate at which these cysts they grow, it is around 1 centimeter per month. And if they keep lying there, if they getting developed, if they keep growing, they can go as big as more than 30 centimeters without getting ruptured, right? So the most average, or if we say the average size, remains to be at around 5 to 8 centimeters, but these can range from few millimeters to more than 30 centimeters. These can be these can be one to multiple cysts. So it is not necessary to have one cyst. There can be the formation of multiple cysts, And these can just not form at one particular site, they can be found in multiple organs in human body as well, right? So we've spoken about the different layers of cysts and what are their compositions, but we also need to know what are the different varieties of cysts. There can be different types of cysts and based on the development of these cysts, right? 𝗘𝗵𝗄𝗃. So these can be primary cysts, secondary and 𝗘𝗵𝗄𝗃. So when we say the primary cysts, so the primary, that means conventional cyst, the conventional development of the cyst. And how is that occurring? It is mostly because the 𝗕𝗵𝗄𝗃, it is going to get ruptured, the one that we saw in the life cycle, the 𝗕𝗵𝗄𝗃 that gets ruptured and the oncosphere that is released out, and that oncosphere is going to develop into these fluid-filled cavities. So first is definitely because of the rupture of the release of oncosphere release. Secondary cysts develop when there is going to be a rupture in the primary cyst which has already developed, and because of that rupture, these cysts, they tend to move towards other organs and they will be taken via circulation. Then these primary cysts, via circulation, they are taken to different other organs. So the cysts which are developing from the already existing cysts in the body, these are known as the secondary cysts. And what are these 𝗘𝗵𝗄𝗃? These are nothing but empty cysts which do not have protoscolices or any other structures inside, right? So these are the variety of cysts you must know. And daughter cysts we have already developed when the brood capsule ruptures. Brood capsule gets ruptured and then the internal structure, it forms into another cyst which get enclosed by endocyst plus ectocyst, two layers. Gives the appearance of cyst within cyst, right? Having said that, let's move on to the fate of these cysts. What is exactly going to occur? So since we said these cysts can, if left untreated, they might form or they might develop into very, very large structures. So are these cysts always going to be present inside human body, or is there a way out, right? Either we need to get them, they need to get treated. Of course, they need to get treated. So what is going to happen, right? What is the fate of these cysts? So firstly, either they can get spontaneously resolved, spontaneous resolution can occur, right? Or secondly, there can be rupture. One rupture we have already discussed that it will lead to the formation of secondary cysts, right? Secondary cyst. Or what hazardous complication can occur because of that rupture? It can be the anaphylaxis. Anaphylaxis that occurs because of the rupture, right? This is very, very important. So it is here when we require prompt treatment. We do not want the cyst to rupture inside the body and develop into, we do not want the patient to land up in emergency state, right? So we need to get rid of these cysts as soon as possible. So what is the clinical picture? We have said that these cysts are going to get developed into the body, and they might be present at one site, they might be present at different sites. So what is the most common site that is, where this cyst goes? So it is the liver. It is the liver which is the most common site affected, seen in 60 to 70% of cases. And what lobe of liver? It is the right lobe of liver. So whenever asked cystic hydatid disease, what is the most common site? This is the most common site, liver. Seen in 60 to 70% of cases. Now it is also the second most common site is going to be the lungs, which take around 20 to 30%. Right? Then the next organs can be kidney and spleen. Kidney, spleen, which will sum up to 3 to 5%. And although heart, it is rarely affected, but to add to the percentage, it is 1 to 1.5%. Right? So now moving on to the symptoms. Firstly, we know that the structure, the cystic structure, it might get enlarged to a very big structure. So naturally, if it is going to be big, it is going to be enlarged. We might palpate it. We might be able to palpate it, right? So there can be a palpable abdominal mass. Secondly, because of its enlarging nature, ever-growing nature, it might at one point, it can obstruct the biliary tree, right? And because of the obstruction of biliary tree, what can happen? Firstly, there can be cholestasis, and of course the infection, right? There can be cholangitis. So these are what? These are complications related to this particular disease, the presence of this cyst. And then the anaphylaxis reaction, which is very important. What is happening? Because of the hydatid fluid, patient might develop hypotension, fever, syncopal attack, right? Hypotension, syncopal attack, all these can land the patient in emergency situation. So it requires a prompt treatment. And lastly, secondary bacterial infection. A foreign body or a foreign structure developed from a parasite, it is lying inside the body, right? If it lies for a really long time, so it acts as a nidus for the growth of new bacteria. So bacteria get food out of it. So it might lead to secondary bacterial infections, and these will develop, these will be seen, they will present as pyogenic abscesses. These are all complications related to the presence of these cysts. Pyogenic abscesses, anaphylaxis, cholangitis, cholestasis, etc. Right? So now the images. Why do we firstly, when we say we require imaging to make a prompt diagnosis out of it? So first thing is X-ray findings. Why do we require X-rays to be done when these cystic or fluid-filled cavities can be detected very well under an ultrasonography, right? So firstly, X-rays are going to help us with location of the cyst in the lungs, whether the cysts are present in the lungs or not. We first need to rule out whether it is just the liver which is most commonly affected, or we have to rule out that lungs are not getting affected out of it. So these, firstly, they are going to detect the presence of cysts in lungs, and secondly, if it lies for a very long time, right, the structure might get calcified. So X-ray also helps us understand or find out whether there are any calcifications. Then ultrasonography, it shows around 90% accuracy rate. 90% accuracy is seen under ultrasound. Now let us gear up and remember our mnemonic or the first mnemonic that we used, that was district hospital ECGs, right? And the structure of the cyst. So this will help us understand these images better. So can you appreciate this round echogenicity? And also, if you look closer, if you look around, can you see this small, granular structures, small granules present only at the lower end of this structure? So these are nothing but the protoscolices, or the future heads, which are getting deposited at the bottom of the cyst structure, right? So it is the brood capsule which has ruptured, and it has led to the led to this breakage and the presence of these structures at the bottom of the cavity, right? So these also give us a very important sign. So this sign, which is very important for your exams, it is fallen snowflake sign. Fallen snowflake sign, right? These appear as if the snowflakes have fallen down, and this is very easily, appreciable under the ultrasound. Also, ultrasound helps us detect or helps us know that whether the, infection is, or the presence of cyst, is it an active stage? So it helps us understand these different stages of the disease. So we also must know that this fallen snowflake sign, if seen, and you see the protoscolices fallen down, this is one of the active stage of the cyst, right? So now moving down to another image. Here also I think we are able to appreciate very well this round structure and multiple round structures present inside this hole, right? So what are these? These are nothing but the daughter cysts which are present, and these daughter cysts are giving a very important sign. We have already discussed cyst within cyst appearance, but the sign, the radiological sign which we have discussed with the letter H, it is the honeycomb sign. Honeycomb sign, which is also an active stage of disease. Active stage of disease, right? So now moving towards another stage. Now this is very important, and about this we have not discussed so far. So if you're able to appreciate, you see these two similar structures, right? Both lying besides, right? But if you look closely, there is some gap in this image, whereas the gap is not present between these two lines in this image, right? Why is that happening? Firstly, this particular layer, which is, present irregularly inside a cavity, or this round structure, this is the echogenicity. This round structure, this irregular structure rather, it is the germinal layer or the endocyst. So because of rupture, at times this germinal layer, it gets collapsed and the fluid leaks out in the cyst only, right? So this germinal layer, it keeps floating inside the cystic fluid only. So it keeps floating and it keeps changing its shape in the fluid only, right? So this sign, the structure that keeps floating on the fluid, it gives a very, very important sign, which is known as the water lily sign. Water lily sign. Most important question from this topic. Water lily sign, germinal layer which gets collapsed and the fluid leaks out. So this is seen as dancing inside, right? So this is a very important sign. And also the stage We have already discussed about the two active stages. So this stage is the transitional stage. So it is transitioning from the active to the inactive stage. And when will we see the inactive stage? When all the internal structure would be present or would be seen as a cotton wool, right? So that would be going to be in inactive stage, but this stage, it is the transitional stage, which is very easily appreciable on the ultrasonography, right? Now moving towards the CT scan. CT scan, it is the most accurate, and it is going to help us detect so many things. Firstly, the exact site, whether it is giving us multiple cysts or is it a single cyst, whether there are any calcifications occurring. So the most accurate diagnostic test is going to be CT scan, but mostly ultrasound only helps us diagnose these stages, whether it is active or inactive. So these are the important imaging techniques or these radiological tests done in order to detect this particular disease. Now what is the treatment? Of course, surgery remains the mainstay of treatment, but in certain conditions like debilitated states, older patients, or those patients who are not fit for conservative management, so we go for surgeries, right? But in normal patients, in doing well patients, we do a particular conservative management or a palliative thing, which is known as PAIR. PAIR, which stands for puncture, aspiration, injection, and reaspiration, right? So what we do in this conservative management? This is the conservative management. And what are we exactly doing in this particular technique? Firstly, we are going to percutaneously puncture of the cyst. And this you must also know that there are certain conditions where this PAIR technique is contraindicated. Firstly, if it is the cyst is present very deep and it is not easily localizable. Secondly, if it is communicating with the biliary tree, we might just puncture the gallbladder, or it might lead to another hazardous complication. So we are not going to touch that particular cyst, right? And so first step that we do is we are going to percutaneously puncture the cyst structure. Then what we are going to do, we are going to aspirate around 10 to 15 ml of this fluid, right? We are going to aspirate out around 10 to 15 ml of this particular fluid. And in the next step, what are we going to do? We are going to inject certain scolicidal agents. What are these scolicidal agents? Most commonly, we are going to inject hypertonic saline, and alternatively, we can use ethanol, and we can also use cetrimide. As scolicidal agents. So what are these going to do? These are going to kill the internal structure present in the cyst. So further developmental stages will be halted, right? And they will not lead to formation of multiple daughter cysts. There will not going to be any other development that is going to occur after getting or after injecting the scolicidal agent. And finally, what are we going to do? We are going to re-aspirate the fluid after 5 minutes. After 5 minutes, we are going to re-aspirate the fluid. And this is how we do the conservative management of this particular structure or in this particular disease, right? Since we have already spoken about Echinococcus granulosus as a whole, the most important species, now we will come to the another species that is the Echinococcus multilocularis. So it causes alveolar echinococcuses, just like these multiple locules will resemble the lung alveoli. Now comes the catch. So we have spoken about multiple locules which are also seen in the lung alveoli, but what is the most common site? You must remember, liver still remains the most common site, and it is the commonest, that is in around 98% of cases. It is the liver where these particular cysts develop, and it is only 2% where lungs might get destroyed. So do not get confused with the name alveolar echinococcus that it is definitely going to affect the lungs. No, it is still the liver which is getting affected by this particular parasite species. So what are the symptoms? Symptoms are going to be similar with that seen in, Echinococcus granulosus, but there can also be portal hypertension, right? There can also be portal hypertension. There can be hepatomegaly. And one important thing, so the cysts which are forming in this disease are not, firstly, they are not globular or they are not very well defined. They are going to be irregular. They'll have irregular margins, right? And these cysts are going to be composed of solid masses. And there's not going to be presence of any fluid. So this is a major difference. These cysts would be composed of solid masses. They'll have irregular margins, and liver still remains the most common site. Also, the pathogenesis, although still remains the same for alveolar echinococcuses and Echinococcus granulosus, but the definitive host and the intermediate host are going to change. Definitive hosts are going to be wolves and foxes, whereas the intermediate hosts are going to be rodents. These will include mice, squirrels, etc. Mice and squirrels, and the pathogenesis is still the same, and humans are definitely going to be the accidental host again. Pathogenesis remains the same, but only the structure that is changing. These are solid masses, right? And liver still remains the most common site. Coming to these very less important species which are not associated with human beings, but if asked, what is 𝗤𝗏𝗓𝗏? 𝗤𝗏𝗓𝗏, it is, it sounds similar to poly. So this will be responsible for polycystic hydatid disease, right? And oligarthris, olig means one. So in general, when we talk that, polycystic hydatid disease would be caused by these two species, but when we come closer or when we talk more specifically, olig means one and these will be unicystic. But since these are not associated with human infection, so we need not get into details of this, but if asked, you can very well say that these can be responsible for polycystic or unicystic diseases. Coming to the last thing, that is the differences, the most common differences which you must know from this topic. It is the site, liver for both the type of diseases, both the type of infections. Content, for cystic, it is going to be fluid, it is going to be solid mass. Intermediate host for cystic disease, it is sheep. and intermediate host for alveolar echinococcus, it is the rodents. Talking about the size. So size 5 to 8 centimeters, it is the average size, and these are much smaller. These cysts are much smaller and they can range from 1.5 to around 2.7 millimeters. So these are much smaller and these are solid with irregular margins. Right, so this was about the very important points, or very high yield points from this particular parasitic infection.